Yearly, 100,000 persons are affected by glaucoma, a major cause of blindness in the world. Today on Sound Health, we will find out how to prevent and manage glaucoma. I'm Olasunbo Modupe. Welcome to the show. Thanks for staying with us. It's still Sound Health on Lagos Television, and today we are looking at glaucoma, and I have with me an ophthalmologist, Dr. Olayemi Olorundare. Welcome to the program, Doctor.
Thank you very much. It's good to be on this program.
Okay, Doctor, according to the World Health Organization, glaucoma is one of the causes of blindness in the world. What is glaucoma and what causes this condition?
Thank you very much for that question. Glaucoma, in very simple terms, can be described as a group of diseases in which there's damage to the optic nerve. The optic nerve is the nerve that is responsible for vision. It's just like you not paying your NEPA bills and they come to disconnect the cable. So the optic nerve connects the eyeball to the brain. So what happens in glaucoma is that the nerve gets damaged progressively over time. And you can just imagine that there are a number of smaller nerves that come together to make up the optic nerve. So with continuous damage, each nerve, takes care of vision to an extent. And once that nerve is damaged, the aspect of vision it takes care of is gone. So over time, as the nerve gets destroyed, vision also is lost progressively.
What are the risk factors, and does this condition affect only older persons in the society?
Glaucoma typically affects adults. That's looking at people 40 years and above. But having said that, it can actually cut across every age group. We've seen babies who have glaucoma. We've seen teenagers who have glaucoma, young adults, elderly. So it can affect any age group at all. Talking about the risk factors, which is very important here, because for the common type of glaucoma, there's really no single cause, because we call it primary glaucoma. So some of the risk factors will include that which I've mentioned before. Advancing age is a risk factor. Then the family history also, heredity is also a strong risk factor. Other risk factors will include people of African descent, that's the black race. Also, there's a type of refractive error, that's an error in seeing that we call myopia, which generally people call short-sightedness. So that also is a risk factor for glaucoma. Other things that usually is what we determine in the hospital will include things like people constantly have pressures that are above 21 millimeters of mercury, which...
Can you make that simple?
Okay, the normal pressure in the eye, normally in the eye, there's an amount of pressure that is needed to keep the eye healthy, and that is between 10 and 21. The unit is millimeters of mercury. When it's above that, we call it elevated pressure in the eye. So if constantly, when the person, for instance, comes for an eye check, and it's always at that level, above 21, that also is a risk factor for glaucoma. Other lifestyle habits like smoking, alcohol are also been known to contribute as risk factors too.
Okay, aside from smoking, could the use of computers, regular watching of TV increase the chances of glaucoma?
The use of computers, TV, I know in our own present time, there's a lot of, I would even say, abuse of that. People spend long hours in front of their monitor. Some because of work demands, yes, but again, you leave work, you're on your tab, you're on your phone. That in itself would not contribute to glaucoma or will not lead to glaucoma. But again, just to add that, one needs to be cautious about that because it can lead to additional strain on the eyes, yes.
Unfortunately, in this part of the world, we hardly visit the hospital. How do you prevent this condition? Is the condition preventable? How do you prevent glaucoma?
Glaucoma as a disease of the eye, it cannot be prevented. Okay. But the blindness that comes from glaucoma can be prevented. And the key way of trying to achieve that's preventing the blindness, is by early detection. And the only way one can detect glaucoma early is by regular eye check. So even though it's not it's not popular amongst us to go for eye check, it's still one thing that we keep emphasizing over and over again. It has to become something that that everybody becomes used to. We need to get our eyes checked. That's the only way to detect and to begin to treat if glaucoma is detected in the eye.
All right, Dr. Olorundare, is this condition treatable, and is it accessible? Is treatment accessible in Nigeria?
Oh yes, glaucoma is treatable. And in terms of accessibility, I would say yes, because of the importance of that we attribute to that disease condition. It's the leading cause of blindness all over the world, and so every ophthalmologist is particularly interested, in the management of glaucoma. So indeed, it's accessible. It's at the level of the private clinics, hospitals, the government hospitals. Yes, you can access care and easily enough.
The World Health Organization aims to eliminate avoidable blindness by the year 2020 with a project called The Right to Sight. What do you think the government, healthcare providers, and people in the society generally can do to achieve this deadline?
Well, I would say that it's work in progress. Yes, the setting deadlines is good, but what is more important is just like you said, the concerted effort that is required. The government has a role to play. The practitioners, the eye practitioners have a role to play. The public have a role to play. Government, in terms of making the working environment conducive enough in terms of providing facilities that one can use in detecting, in monitoring this disease, and also well, even if with regards to treatment also, some of the drugs indeed and the procedures we need to treat, they are still quite expensive. So even at that level, policies can be put in place to ensure that in terms of treatment, it's made more affordable for the people. Of course, creating public enlightenment, as we are doing now from the healthcare practitioners, is also very important. Then the general population should avail themselves of the opportunity. We can't overemphasize the need to have one's eyes checked regularly.
According to Glaucoma Research Foundation, approximately 10% of persons diagnosed of glaucoma still experience loss of vision after proper treatment. What could be the cause of this, and could there be a relapse?
One major issue we have in this part of the world is late presentation. And it's known that when people present late, it's found that how much of management one can give in terms of stopping the progression of glaucoma itself becomes a bit reduced. So again, when people present late, they will fall into that category of people who still continue to experience vision loss despite the fact that you are treating. So again, early presentation will go a long way in having people that you are treating. Your management appears to be going on well to an extent, but yet the vision keeps on dropping. So early presentation is quite important. The treatment for glaucoma is lifelong. So we don't usually talk of relapse when we are treating glaucoma. So that's what we impress on the minds of the patient when they come, that this treatment is lifelong. Yeah.
Okay, thank you so much, Dr. Olayemi Olorundare, for sharing your expertise with us on preventing and managing glaucoma.
Thanks for having me.
Okay, that has been Dr. Olayemi Olorundare, an ophthalmologist on managing glaucoma. Sound health continues with trending and home essentials. Please stay with us. The program continues shortly. This is where we say thank you on today's edition of Sound Health. Remember, regular visits to an ophthalmologist will prevent loss of vision. For comments and inquiries, please send SMS to 0818-815-3695 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.